Hello guys, welcome back to my channel. Kindly watch until the end of the video and please do like, share and subscribe. The human heart is an organ that pumps blood throughout the body via the circulatory system, supplying oxygen and nutrients to the tissues and removing carbon dioxide and other waste. The right side of your heart receives oxygen-poor blood from your veins and pump it to your lungs where it picks up oxygen and gets rid of carbon dioxide. The left side of your heart receives oxygen-rich blood from your lungs and pump it through your arteries to the rest of your body. In this video, let's discuss about heart attacks. During a heart attack, the blood supply that normally nourishes the heart with oxygen is cut off, and the heart muscle begins to die. Millions of people die due to heart attacks each year. Heart attacks are also known as myocardial infarction. Myo means muscle, cardial refers to the heart, and infarction means death of tissue because of lack of blood supply. This tissue death can cause lasting damage to your heart muscle. Heart attack is a serious medical emergency. Immediate medical attention can save the person's life. Symptoms of a heart attack include discomfort, pressure, heaviness, tightness, squeezing or pain in your chest or arm or below your breastbone. Discomfort that goes into your back, jaw, throat or arm. Fullness, indigestion or a choking feeling. Sweating, upset stomach, vomiting or dizziness. Severe weakness, anxiety, fatigue or shortness of breath. Fast or uneven heartbeat. Symptoms can be different from one person to another or from one heart attack to another. Women are more likely to have symptoms like nausea or vomiting, shortness of breath, back or jaw pain. Men are more likely to have symptoms like right-sided chest discomfort and indigestion. With some heart attacks, you won't notice any symptoms, and this is also known as silent myocardial infarction. This is more common in people who have diabetes. The heart muscles needs a constant supply of oxygen-rich blood. Your coronary arteries give your heart this critical blood supply. There are a few cardiac conditions that can cause heart attacks. One of the most common causes is plaque buildup in the arteries or atherosclerosis that prevents blood from getting into the heart muscle. Fat, calcium, proteins and inflammatory cells build up in your arteries to form plaques. These plaque deposits are hard on outside and soft and mushy on inside. Heart attacks can also be caused by blood clots or a torn blood vessel. Less commonly, a heart attack is caused by a blood vessel spasm. When the plaque is hard, the outer shell cracks. This is called a rupture. Platelets come to the area and the blood clots form around the plaque. If the blood clot blocks your artery, your heart muscle becomes starved for oxygen. The muscle cells soon die, causing permanent damage. Rarely, a spasm in your coronary artery can also cause a heart attack. During this coronary spasm, your arteries restrict or spasm on and off, cutting off the blood supply to your heart muscles, or ischemia. It can happen while you are at rest, and even if you don't have any serious coronary artery diseases. Each coronary artery sends blood to different parts of your heart muscles. The muscle damage depends on the size of the area that the blocked artery supplies and the amount of time between the attack and the treatment. Your heart muscle starts to heal soon after a heart attack. This takes about 8 weeks. Just like a skin wound, a scar forms in a damaged area, but a new scar tissue does not move the way it should. So your heart cannot pump as much after a heart attack. The ability to pump is affected and it depends on the size and location of the scar. After a heart attack, you need quick treatment to open the blocked artery and lessen the damage. The best time to treat a heart attack is within 1 or 2 hours after the symptoms begin. Waiting longer can lead to more damage to your heart and a lower chances of survival. Tests to diagnose a heart attack, and this includes EKG. An EKG is also known as an electrocardiogram or ECG, and this can tell how much your heart muscle has been damaged and where. It can also monitor your heart rate and rhythm. Blood tests. Different levels of cardiac enzymes in your blood can indicate heart muscle damage. These enzymes are usually inside the cells of your heart. When those cells are injured, their contents, including the enzymes, spill into your bloodstream. By measuring the levels of these enzymes, your doctor can find out the size of heart attack and when it started. Tests can also measure the troponin levels. Troponins are proteins inside the heart cells that are released when the cells are damaged by the lack of blood supply in your heart. Echocardiography. This imaging test can be used during and after a heart attack to learn how your heart is pumping and what areas aren't pumping the way they should. The echo can also tell whether any part of your heart, like valves, septum, have been injured in the heart attack. Cardiac catheterization. You might need cardiac catheterization during the first hours of an attack if the medications aren't helping the ischemia or symptoms. This is a probe that is inserted in your blood vessels through a soft flexible tube called a catheter. Here you can see the cardiac catheterization in an aneurysm. But in heart attack, it allows your doctor to view areas where the plaque may have been built. Your doctor can also inject dye into your arteries through the catheter and take an X-ray to see how the blood flows, as well as view the blockages. Other common procedures include angioplasty. An angioplasty opens the blocked artery by using a balloon or by removing the plaque buildups. Stent. A stent is a wire mesh tube that is inserted into your artery to keep it open after the angioplasty. Heart bypass surgery. In bypass surgery, the doctors reroutes the blood around the blockage. Heart valve surgery. In valve replacement surgery, the leaky valves are replaced to help the heart pump. Pacemaker. A pacemaker is a device implanted beneath the skin. It is designed to help your heart to maintain a normal rhythm. Heart transplant. A transplant is performed in severe cases where the heart attack has caused permanent tissue damage or death to most of the heart. The doctor may also prescribe medications after a heart attack, and this includes drugs to break the clots, antiplatelet and anticoagulants, also known as blood thinners, painkillers, nitroglycerin, and blood pressure medications. Several complications are associated with heart attacks. When a heart attack occurs, it can disrupt your heart normal rhythm, potentially stopping it altogether. These abnormal rhythms are also known as arrhythmias. When your heart stops getting a supply of blood during the heart attack, some of the tissue can die. This can weaken the heart and later causes life-threatening conditions such as heart failure. Heart attacks can also affect your heart valves and causes leaks. The amount of time it takes to receive treatment and the area of damage will determine the long-term effects of your heart. To keep heart disease from getting worse and to head off another heart attack, you might need to change your lifestyle. And this includes stop smoking. Smoking is a major cause of heart disease. Starting a smoking cessation program can reduce your risk. Control your diabetes and blood pressure. Follow an exercise plan. Keep a healthy body weight and control stress. Thank you for watching. Hope you guys like this video and see you all in next video.